Different areas of the country are seeing drastically different trends in coronavirus cases. It's left different states trying to figure out what restrictions to change or continue. Our national investigative team looks at states where cases are dropping and where they are picking up. Here's Lee Zurich with our COVID-19 tracker.
A warning from doctors.
I have 3 individuals in their 30s and 40s in my intensive care unit with very severe cases of coronavirus. So anybody, anytime can get impacted by the coronavirus.
As economies open up, new coronavirus cases are increasing in some parts of the country.
This is really associated with the loosening of the restrictions and our greater social interaction, and this is going to be bad.
Is the increase in cases in some of these areas now just a product of us testing more, or is it something else?
Well, some of it is definitely testing more. There's no question about that.
But in some areas, Yale Dr. Howard Foreman says the increases can be attributed to a spreading virus.
The Southeast looks particularly bad. States like South Carolina, North Carolina, Mississippi, Alabama look really bad. Arizona looks really bad, consistently bad.
In the past 7 days, the Spencer-Spirit Lake, Iowa metro area has the most new positive cases per capita. Next is Montgomery, Alabama, Monroe, Louisiana, Myrtle Beach, South Carolina, and Phoenix.
We're not going to see spikes. Everybody says spikes and explosions in cases. We are not going to see that the way we did in New York, Massachusetts, Connecticut early on. And the reason is that we do have much better testing. We do have some degree of social distancing and mask wearing. We have much more awareness. There's much more fear. But it doesn't mean that we won't see a slow growth in cases to the same ultimate level that we already saw in New York.
Our analysis shows the number of patients in hospitals increasing in several states, including Arkansas, Arizona, North Carolina, and Texas.
The hospitalizations we're seeing today are probably from infections of 2 to 4 weeks ago.
The number of patients in the hospital in most states is on the way down. And in states like Illinois, Wisconsin, New Jersey, and New York, the number of positive cases are also on the decline. But it's those trouble spots that have some health experts concerned, like in South Carolina, where the curve is not flattening.
Right now, South Carolina, Horry County is spiked up again. People are not wearing masks. I think they forgot about it. But this corona isn't nothing to play with. It's coming back strong.
Our team's analysis of current hospitalization data from the COVID tracking project shows nationwide hospitalizations are at about 27,000 people. April 15th was the peak, with more than twice as many people in the hospital then. Up next on Valley News Live 10 at 10, from restaurants to retail, people are feeling more comfortable spending money.